Welcome. This is Casey Bateman, naturopathic doctor. I am very excited to present today's webinar on auricular medicine, sponsored by Physica Energetics. I'm going to start off by telling you how I found auricular medicine. It all started in 2003. I was a third-year student at the Canadian College of Naturopathic Medicine, and I had been in school non-stop since kindergarten. I was burnt out, tired, and extremely anxious. So much so that I almost dropped out of the naturopathic program. Fortunately, I was referred to Michael and Allison Adams by a friend. Both of them practice auricular medicine, and I ended up becoming a patient of Allison Adams, and I had positive results right away. I knew I had to learn this technique called auricular medicine. So, in 2003-2004, I studied auricular medicine with Michael and Allison Adams. And I had the relatively unique experience of beginning my practice, my private practice, from day one, practicing auricular medicine with every single patient. Since 2004, I have assessed and treated over 1,000 patients with auricular medicine. I currently have 2 practice locations in Burlington and Brampton, Ontario, Canada. If you'd like more information about me and my practice, you can find that at www.caseybateman.ca. Today, I'm going to answer 2 questions for you. What is auricular medicine, and why auricular medicine? As I was preparing for this webinar, I found this quote. "If I have seen further, it is by standing on the shoulders of giants," from Sir Isaac Newton. And one of these giants, no pun intended, Dr. Noget was actually quite tall, was this gentleman here, Dr. Paul Noget, medical doctor, neurologist. And he lived from 1908 to 1996 in Lyon, France. And he was considered the father of auricular therapy and auricular medicine. He began studying the ear in 1951 when he noticed that there was a lay person in France at the time that was cauterizing points on the ear in order to treat sciatica. So he spent the next 5 years studying this, studying the auricular reflex zones and points. And he first reported this work in 1956. Interestingly, did you know that it is not possible to find TCM acupuncture charts of the ear published prior to 1956? So any of these types of auricular charts that you've seen in Chinese medicine textbooks all come after 1956, and they all come from Noget's work. So Noget was my teacher's teacher. This is Dr. Michael Adams. He's a naturopathic doctor, and he graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1981. He studied with Noget for 10 years in France in the late 80s and the early 90s. Since studying with Noget, Dr. Michael Adams has significantly advanced the development of auricular medicine, incorporating modalities such as nutrition, homeopathy, biotherapeutic drainage, intention, and intuition into auricular medicine. Michael currently practices in Milton, Ontario with his wife Allison Adams, who is an acupuncturist. So this brings us to the topic of traditional Chinese medicine acupuncture versus auricular acupuncture. If you know your TCM meridians, you know that many meridians go nowhere near the ear, and traditional Chinese medicine acupuncture points are based on meridians. So if the whole body is represented in the ear, the auricular points must be based on something other than meridians. And in fact, auricular acupuncture points are based on anatomical reflex points. So here are some examples of anatomical reflex points that you may be familiar with. I often use the feet, or the reflexology of the feet, to explain auricular to my patients. Because most people have heard, at least have heard of reflexology and the idea of the whole body being represented in the feet. Most people listening to this webinar would be involved in natural medicine in some way, I imagine, and you've probably heard of iridology as well, how the whole body is represented in the eye or the iris. Some of you may have even heard of Korean hand acupuncture, which is the whole body is represented in the hand. And if you've studied anatomy, you'll know that the sensory cortex of the brain also has a representation of the whole body. And we see this funny picture of the man with the big lips and the big tongue and the big hands and the big feet and the small body. And the whole body is represented in the sensory cortex. This concept is called a homunculus. And the auricle, or the ear, the external part of the ear, is a homunculus. So the question is, what is a homunculus? Well, it comes from the Latin for little human, and it means a fully formed miniature human body. That's it. That's a homunculus. So the question is, why the auricle? Well, the ear is highly innervated. As you can see in this picture, there are 4 major sets of nerves that innervate the auricle, or the external part of the ear. There's 2 cranial nerves, the trigeminal and the vagus, so cranial nerve 5 and cranial nerve 10, as well as the superior cervical plexus, which is part of the vertebral nerves, and the 4th set would be the cranial parasympathetic system. So very highly innervated tissue. One really important thing to touch on here is that you'll notice that the cranial nerve 8, which is the vestibulocochlear nerve, is not innervating the external part of the ear. I work with a number of deaf patients, and auricular works just fine with them because there is no association with being deaf and not being able to use the ear. So just in case you're wondering if a person is deaf, would that mean you can't do auricular? Not at all. There are 3 phases of the auricle. So I've shown you this first picture here on the left. This is phase 1. And you'll notice I put it in red on purpose. The next is phase 3. And the one on the far right here is phase 2. Phase 1 is red, phase 3 is blue, phase 2 is green. I'm going to come back to that. You'll notice that if you pick a particular structure that you see in phase 1, let's take the knee, which is in the upper part of the ear, in phase 1. In phase 3, it's in the bottom of the ear, near the lobe. And in phase 2, the knee is in the middle of the ear. And if you do this for any other structure or organ in the body, you'll find that every single one has 3 different points or areas on the ear. So these different phases represent the phase of pathology that these organs or structures are in. Phase 1 is acute, phase 3 is chronic inflammatory, and phase 2 is chronic degenerative. I said I'd come back to the colors. Now, phase 1 is represented by the color red. Phase 3 is represented by the color blue. And phase 2 is represented by green. So we use filters, a red filter, a blue filter, and a green filter to help us determine which phase the point that we're finding on the ear is in. This is very important to be able to determine what level of pathology the organ that you're treating is in. Therefore, that may impact how you treat that imbalance or that organ that is out of balance. Chronic degenerative would definitely be treated differently than an acute imbalance. So if you do a Google search for auricular, you're going to find a lot of stuff about auricular therapy. And as I mentioned in the beginning, Noget was the father of both auricular therapy and auricular medicine. They're not the same thing. Auricular therapy came first, and later came auricular medicine. Noget actually wrote a book, I have a copy of it, it's very old, called From Auricular Therapy to Auricular Medicine. There's still a lot of people out there that are doing auricular therapy. That's fine. I'm not saying there's anything wrong with it. It's just not what I do. And in the courses that I'm going to be teaching coming up in the next couple months, what I practice and what I'm going to be teaching is auricular medicine. So let me tell you a little bit about what the difference between auricular therapy and auricular medicine is. Auricular therapy is a physical reflex technique in which points on the auricle are detected that are sensitive to pressure and/or electrical measurement. These points are used to assess and/or treat various conditions by means of manual, electrical, or other stimulation of the the auricular acupuncture points. Auricular medicine is an energetic reflex technique which is based on auricular therapy, and the the three phases of the ear, in which points on the auricle are detected using a pulse change. Not a pulse change in the ear, a pulse change generally measured in the wrist or the radial pulse. The detected points are used to assess and or treat various causal blockages through treatment to the ear or an appropriate remedy. So I mentioned the pulse. What is the pulse? The pulse is a significant pulse change upon presenting stimuli to the patient. This change is a qualitative change, not a quantitative change. We're not talking about the pulse speeding up or slowing down. It is the best described, in this instance I can describe it very easily by using sound. Of course now the pulse isn't making sound, but just bear with me for a sec here. So a normal pulse would be boom, 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 boom. A pulse change would be like this. Boom, 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 boom. So as you probably heard there, I got louder. And as you're feeling the pulse, when you get a pulse change, the best way I can describe it is it gets louder. This pulse change is also known as the vascular autonomic signal, or the VAS, V-A-S. This is generally measured using the radial pulse. We use our thumb, not our fingertips. The thumb has, of all the fingers, has the largest representation in the sensory cortex of the brain, so it is the most sensitive. You could use your fingers. It's recommended to use your thumb. The best part here is the pulse is very easy to learn. I have recently, I had a patient in, and he was very interested in what I was doing with this pulse thing. And he happened to be at the appointment with his mom. And I said, well, if you guys have a couple minutes, I have a couple minutes, let's get your mom on the table here and I'll show you. And his mom was comfortable with this because she's been a patient of mine for a while. So we got mom on the table, and within 5 minutes, I taught him how to find the pulse change. It's very easy to find. I should mention, this young man is 9 years old. So I was able to teach in 5 minutes a 9-year-old how to find the VAS, or the pulse change. So I think if a 9-year-old can do it, anyone can do it. It is not hard to learn. So that brings us to the ear and the VAS, or the vascular autonomic signal, or the pulse change. So we use a three-phase filter. This three-phase filter, which looks like this, is moved quickly towards the ear with one hand, while the other hand is taking the patient's pulse. So here's a picture of me and my dispensary manager, Mary. And just for the record, she said it's okay to use this picture. So you'll notice my left hand, the one closer to the wall, is holding her wrist, and I'm taking her pulse with my thumb. With my right hand, I'm bringing my three-phase filter, this black thing you see here, in towards her ear. And as the practitioner, I'm feeling for the distance from the ear in which a significant pulse change occurs. So I will reach out basically as far as I can with my arm, and I will bring this filter in line with the ear, straight in towards the ear relatively quickly. And then I'm feeling for what distance from the ear the pulse change, the significant pulse change occurs. So the next question is, what does the pulse change mean? As the practitioner brings the three-phase filter towards the patient's ear, the edge of the patient's electromagnetic field, or EMF, is indicated by the distance from the ear that the VAS is found. I realize I forgot to mention the significance of the three-phase filter. The three-phase filter means those three phases, the red, the blue, and the green, because we don't know when we're first assessing someone what phase the points on their ear are in. We have to use all three. So the three-phase filter has a red film, a blue film, and a green film all layered on top of each other. That's why you see it, that when I showed it to you in that last image there, as it being black, because it's got those three colors layered on top of each other. So we bring that three-phase filter towards the ear. And as the practitioner brings the three-phase filter towards the ear, the edge of the patient's EMF is indicated by the distance from the ear that the vas is found. So what we're really looking for here, what we're detecting with the pulse change as we bring this three-phase filter towards the ear, is the edge of the patient's electromagnetic field. And yes, we all generate an electromagnetic field. Every living being does. And if you haven't heard of this concept before and you're more familiar with Chinese medicine, you may be familiar with the concept or of Wei Qi, or in other words, defensive Qi. This is the Qi that surrounds us, that protects us. We want it right next to the surface of our body, within a centimeter of the surface of our body, including our ears. If the edge of the electromagnetic field is found within 1 centimeter of the ear, the patient is balanced. There is no significant causal issues going on. It's extremely rare to find that the first time someone gets on the table, I'll tell you. I've had it happen down the road after I've seen someone a few times where they get on the table and they're balanced. There's no more layers to work through, but that's happened a few times. Generally, there's always another layer for someone to work on. Even if they're not symptomatic, they're feeling better. That's a really great point to make, is actually that I can use auricular medicine to detect imbalances before they become symptomatic. You can detect imbalances in someone that are going to become symptomatic potentially months or years down the road. So this is really great if you're working with well patients, and we all want to work with well patients. Unfortunately, not a huge part of my practice are people coming in saying, I feel perfectly well, I want to stay this way. I love it when that happens. And this is, I don't know what your experience has been, but when you're working with people that are well, you kind of go, okay, well, what do I do? If they're feeling so great, what reference point do I have to know that what I'm suggesting to them is helping them in any way? And with auricular, we can actually determine where there's blockages that are potentially not even showing up as symptomatic, or that the patient's not aware of at all. If the edge of the electromagnetic field is more than 1 centimeter from the ear, that means the person's imbalanced. So this is what we see most of the time when the person first gets on the table. As I bring that three-phase filter in towards the ear quickly at a distance greater than 1 centimeter, usually like 6 inches to 2 feet, somewhere in there, that's where the pulse change is happening. And what we're looking for is, what can we do to bring this pulse change, the edge of the electromagnetic field, right next to the ear? So the way we go about doing this is by placing different substances on the body, and we test them. So the two main areas that we use are the neck and the arm. So the neck is used for removing information, and the arm is used for adding information. So when we test something on the neck, if the person is out of balance, as they generally are when we first get them on the table, I want to determine what's going on, what organ's out of balance here. So let's just use as an example, the liver. The liver comes up fairly often with people, as we are living in a very toxic environment these days, unfortunately. So if we put the liver filter on the neck, when the pulse change or the edge of the electromagnetic field was, let's just see it for the example, say 1 foot away from the ear. And then we put that liver filter on the neck, and now we test again. And now we're finding the edge of the electromagnetic field is right next to the ear. Then we take the liver filter off the neck, test again, and the edge of the EMF is back out at a foot. Put the liver filter back on the neck, the EMF is right next to the ear. Take it off again, it's back out. You don't have to test it that many times, but that tells you that the imbalance that you're finding out here at 1 foot away from the ear, with the edge of the EMF out here at 1 foot, has something to do with the liver. So then we can use the arm to add information and test remedies and test different types of treatment options. So we're adding this information. So we know the imbalance has something to do with the liver, so that helps us narrow down on what type of different remedies to test. We can also use the neck to take things away, like food and environmental sensitivity. So if you're suspecting the person is sensitive to gluten or dairy or corn or soy or mold or certain kinds of pollen or whatever, you can take a sample and put it on the neck. And if the EMF was happening at, let's say, a foot, and you put a sample of, let's say, gluten on the neck, and you check, and now the EMF is the pulse change is happening right next to the ear, you know that because you're taking that away. You're saying, well, if I remove this from the system, does the person become balanced? And I'm using this a lot in my practice to help guide people as to what foods or environmental sensitivities they need to avoid. Now, ultimately, I'm working towards getting down to the root cause of what's causing these food and environmental sensitivities. But in the meanwhile, helping people identify what is aggravating their condition and suggesting that they remove these from their diet or remove them from their home if possible is extremely helpful to speed up the healing process. The other thing we can check on the arm are what I have here is RX, or prescription medications, and this is really neat. I can test people's prescription medications on them to see what systems are being taxed by these prescription medications. This is very valuable. This is something I'm going to be going into depth in the courses in how to do this and how to test all these different substances. So we're using the pulse and the ear and the electromagnetic field around the body as our framework, or as our indicator for, is this person out of balance, and what can we do to balance them. That's the best way I can sum up what auricular medicine is. So the methods that we would go about treating or balancing some of these imbalances, one way is by treating the actual ear. So there's two main categories of treatment. One is treating the ear using laser, acupuncture, or some people even use electrical stimulation. In my practice, I use a CPES laser. That's CEPES. I got that from Germany. I believe it was about $800. So not too expensive. Or I'll use acupuncture, and I'll use a lot of semi-permanent needles, and I'll use temporary needles. So temporary needles are more like what you'd be familiar with body acupuncture or TCM acupuncture, whereas semi-permanent needles are specifically made for treating points on the ear, and we can leave these semi-permanent needles in for days. So that person's getting that point stimulated not just for half an hour or 45 minutes, but for days, which is really neat. The other major sort of category of treatment options that we have is using remedies, of course. So here are some categories of remedies that I use very frequently in my practice. Single homeopathics, complex homeopathics. So the complex homeopathics, just in case you're not familiar with that term, is things like, if you're familiar with the physical line, the no-so detoxifiers would be a complex homeopathic, so a combination of a number of different homeopathic remedies, or Unde numbers would be, or the Reckewig numbers. These are all complex homeopathics. Nutritional supplements, so like fish oil, antioxidants, multivitamins, any type of nutritional supplement we can test. Phytotherapy or botanical medicine, tissue salts or cell salts, gemotherapy, oligotherapy, flower essences, and even superfoods. And these are some of the main things that I test. But the thing to know here is, if you can think of it, you can test it. And the way I found Physica actually is because I think it's really important to mention here that when you have a framework of all these different things to test that was taught to me by my teachers, I've worked with a lot of what they've taught me, how to use, where to use different remedies depending on what imbalances come up. But I've been striving to add to that. And so through my continuing education, by reading and going to seminars and hearing what different people are doing, learning about different types of remedies and different approaches, that gives me it helps me grow my bank, if you will, my bag of tricks, if you want to call it that, of different things that I can use to balance the imbalances. And I think it's important for us to as auricular practitioners to be continually adding to our bag of tricks. So you're not limited to just a couple things if you're using auricular. You can test any kind of remedy you can think of. That's what I want you to take away from this slide. So this is where I've described what auricular medicine is, and now I want to talk about why the why auricular medicine. In the beginning I said I was going to tell you answer the question, what is auricular medicine? Now this is my favorite part, the why. And I believe my job as a naturopathic doctor is to stimulate the healing power of nature, or what we call the vis medicatrix naturae. So I'm looking to assess what's getting in the way of the body healing itself, and what can I do to get that out of the way. And I'm not saying auricular medicine is the only way to go about doing this, but this is what works for me, and this is a beautiful technique. I am able to get right down to the root cause of what's getting in the way of this person's ability to heal themselves and to have their body function optimally. I believe the body wants to heal itself, and it wants to function optimally. Through the assessment and removal of causal blockages, auricular medicine stimulates the body's self-healing and auto-regulating abilities. So the question is, why is auricular medicine so effective? Well, the individualized assessment of causal blockages, as well as the individualized treatment to remove those causal blockages, and I love this. This comes from Dr. Cass. I couldn't have said it better myself, so that's why I'm saying it the way he says it. Removing these causal blockages at the right level, at the right time, and in the right sequence. And auricular medicine shows us what sequence, what timing, and what level we need to treat and remove these causal blockages. And it is beautiful. The thing I want you to understand about what it makes auricular medicine so effective and so wonderful is that it's efficient. When you're using an individualized approach to assess what's getting in the way and an individualized approach to remove those blockages, you don't have to prescribe 20, 30, 40 remedies to someone. You can do it with a few remedies. And that's what not only makes auricular medicine effective, it makes it economical for your patients. So instead of putting them on 10, 15 remedies and getting results, you can figure out what 3, 4, 5 remedies maybe you need to get the same results, because these are the ones that are actually removing these causal blockages that are preventing the body from being able to heal itself. The other aspect of auricular medicine that makes it very effective is what's behind the causal blockages and how we determine these causal blockages is auricular medicine has an algorithm. I don't have time in this webinar to really get into the algorithm, but there's an algorithm of an approach. So basically, if we see this, then we go here. If we see this, then we go there. It's kind of like a choose your own adventure. And this algorithm has been developed and refined and refined and refined by people like Dr. Adams. Both Michael and Allison have done a lot to create this, what we call the auricular protocol. And I've been working in my 8 years of practice to add to this protocol, to add remedies to it, to expand it, to make sure that we're covering all the bases that we possibly can in assessing and removing any possible causal blockages. This is really interesting. I wouldn't have described myself as a particularly intuitive person if you met me a decade ago. I can definitely tell you that auricular medicine has helped me hone my intention and my intuition. It is a tool to really refine your intention and intuition as a practitioner. I can't promise this will necessarily cross over into your personal life, but it definitely is a great tool to really refine your ability to use your intention, to use your healing intention in your practice, as well as your intuition to, when you get that gut feeling about what's going on with someone. Auricular is just amazing at really, it's exercising this ability. It's important, I guess, to touch on safety. There aren't really a whole lot of safety issues when it comes to using auricular medicine, and that's because we listen to the body. When you listen to the body, any particular treatments or remedies that you would maybe suggest that would aggravate or be unsafe for that particular patient, they don't test well. So if something doesn't test well, I don't recommend it. So in my 8 years of practice, I haven't really had any safety adverse reaction issues because we're listening to the body, and if it doesn't test, we don't do it. And that's why I believe I haven't had any issues in this area. I want to touch a little bit on the limitations of auricular medicine. There are a couple limitations, so it's important for you to know. Auricular medicine is an assessment of causal imbalances or causal blockages leading to symptoms. Auricular medicine is not diagnostic. And what I mean by diagnostic is that a diagnosis in the conventional medical sense is you have these symptoms and these are your lab test results and this is your x-ray or CT scan results or whatever, and this is the name that you have to describe this. That's a diagnosis. Auricular is assessing what's causing this. So I'm very clear with my patients, I don't call auricular medicine a diagnostic technique. Because also, I mean, legally that can get you into a little bit of hot water calling it a diagnostic technique. So we call it an assessment technique, and we're assessing the causal blockages that are leading to symptoms. Another limitation is that the treatment and or remedy options that are limited to the best of what you present. So the less options that you present is not good. I don't know how to say it another way. The more options you present is much better. So because the body will resonate with the best option offered to it. Therefore, it's best to present as many options as possible. And that comes back to continually looking at adding and reading and going to seminars and learning about different types of remedies and how to use them and where they might fit into the auricular protocol, because again, the more options, the better results is what it comes down to. That brings us to what type of equipment do you need to practice auricular medicine. It's essential to have your filters. There are a number of filters that are used to help determine if we remember going back to the neck, we put these filters on the neck to help us figure out which organs in the body are out of balance. And also the three-phase filter is important. That's very essential. You've got to have a three-phase filter. The black and white hammer, this is important for finding points on the ear. And I will spend a lot of time in my courses teaching people how to find the points on the ear. Having a laser is not essential, although I don't know what I would do without it, to be honest with you. This is something that Dr. Adams and I agree on, that the laser, if both of us could only have one thing, we would both agree that if we couldn't use any of the remedies, we couldn't use acupuncture needles, we would do everything we could to continue to use our laser, because you can treat anything with the laser. Just to finish up that point, the laser is not always the best option. Again, if the only thing that you offer is laser, but you can do a lot with laser. The last thing here are the plates and wires, and these are not essential. Some people don't use them. I like to use them. So basically what we have is we have some conductive plates that we can put the different substances, whether it's the filters or remedies, on these plates. These plates are attached to very conductive wires. I use ones that are made out of gold, and they have a diode in them that directs the energy from the plate to the patient and not backwards. And I really like to use these because it really just makes it easier to test. Instead of having to put the filters, the remedies, actually on the patient's neck or arm, I can use these plates connected to the wires to test the substances on the plates as opposed to putting them right on the person. To be honest, it just makes things faster. So you may be familiar with this fine man, Dr. Robert Cass. He is a world-renowned teacher of EAV, which stands for Electroacupuncture According to Vol. He is the founder and chief formulator at Physica Energetics in London, Ontario. And when I first met Dr. Cass about a year and a half ago, we began discussing the similarities between the technique that he practices and teaches called EAV and what I do, auricular medicine. And we realized that these techniques have a lot of similarities. Both techniques are detecting imbalances in the patient through acupuncture points that have little to no electrical resistance. So if I say that a different way, we test the acupuncture points on the meridians or on the auricular acupuncture zones. And when we run a current through these points, we find that the ones that are associated with the biggest blockages in the body have little to zero electrical resistance. Both techniques are very much about respecting the body, the wisdom of the body, getting out of our minds as practitioners, getting out of the minds of the patients and just listening to the body, asking the body what's going on. We realized as we discussed these two different techniques that we're really just accessing the same information with different tools. Both techniques are about assessing and removing causal blockages. And most importantly, both of these techniques respect using the treatments at the right level, at the right time, and in the right sequence to remove the layers, to remove the blockages that are getting in the way of the body's ability to heal itself. So since these two techniques are so similar, we also noticed that there were some things, or I noticed that there were some things that EAV found very important concepts to EAV that I was not aware of as an auricular medicine practitioner. And I figured, okay, if these two techniques are so similar and there are these very central important concepts in EAV, I should look into to see how I can incorporate these concepts into auricular medicine. And these concepts you may be familiar with if you are an EAV practitioner or if you've studied any EAV. The concepts are of cloak disturbances, lymphotoxicosis, and priority point. If you're an auricular practitioner and you're not familiar with these concepts, this is what I will primarily be covering in my advanced class, my advanced course in February. And I'm going to be talking about how I incorporate these concepts into the way I'm practicing auricular medicine now. In case you're wondering, if you're wondering about the introductory course, I will also be working in these concepts to the introductory course that I'll be teaching starting in March. So what I've noticed as an auricular practitioner using some of these Physica remedies is that the body, as I touched on earlier, the body will resonate with the best option offered to it. So, as I mentioned, starting in late 2010, I began testing the Physica Energetics line. And I also began working with some of these concepts that I just mentioned on the last slide about that from EAV, working these concepts into the auricular protocol. So what I've noticed with using these physical remedies is that I am finding that they test well very often. Again, going back to this idea of that the body will resonate with the best option you offer to it. So it's not to say that what I was doing before was wrong, but now that I have these remedies to use, I'm noticing that the physical line remedies Physica Energetics remedies are coming up very often, where other remedies like the Unza numbers, gemotherapy, things like that don't come up as often. And since I've been using the Physica remedies as well as some of these new concepts that I've learned from EAV, I'm getting faster results with less remedies. And I was getting really good results before. So I'm getting faster results with less remedies, even better than before. So I know there's something up with these Physica remedies. They're very powerful remedies. They're just wonderful. So that's another aspect that I'm going to be teaching in both my advanced course as well as my intro course, is how to use these wonderful Physica remedies in auricular medicine. This is really important to me making auricular medicine accessible. I love auricular medicine. It has made my practice. I don't know what I would do without auricular medicine, to be honest with you. It gives me so much information, so much direction of where to go with my patients. I get such wonderful results with this technique. And when I talk to other practitioners and I tell them I practice auricular medicine, they'll tell me sometimes that they're interested in learning auricular medicine. It's just that the courses that are currently offered by other teachers are just too expensive. And I hear that. It took me a while to pay off those courses off my credit card. So what I want to offer, or what I am offering, pardon me, is affordable tuition, as well as the instructor, I want to be easily accessible to my students. So this is another thing that I've noticed. Not only does the cost of studying auricular medicine prevent people from practicing it, once people study auricular medicine, I've noticed there's a number of people that, because of difficulty of getting hold of their instructor to ask questions, to get guidance, that they end up not practicing it. And it's not that it's a hard technique, it's that these people need this one-on-one approach, or working in small groups. They need guidance. And these are the two things that I am doing differently in teaching auricular medicine. Making it more affordable and being accessible as the instructor, because I really want to see my students implement this in their practice successfully so that they can get great results with their patients just like I do. So I'm just going to touch on my teaching experience a little bit. I started teaching auricular medicine in 2009, working in small groups, and I have found that taking the time to be accessible to my students in small groups ensures the successful implementation of auricular medicine in practice. I also happen to be the son of two teachers, so I think it's a possibility that I may have some sort of teaching gene built into me. I've been told that I'm a good teacher and that I am good at getting a point across and explaining things in a different way. And I really believe that actually my job as a doctor, the term doctor coming from the Latin docere, which is the verb to teach, I believe that being a good doctor is about teaching. So I'm very excited to share my knowledge and my experience in auricular medicine with you. If you're interested in looking at some testimonials that people have written about my teaching abilities and their experience with me, you can find them on my blog at www.caseybateman.ca/blog. So here's some information about the auricular medicine courses that are coming up in the next couple months. We have two. There's the intro course and the advanced course. The intro course is designed for healthcare practitioners who want to learn and integrate auricular medicine into their practice. So people that take the intro course do not need to know anything about auricular medicine going into it, and by the end of it you will have the knowledge and you will have one-on-one experience practicing it with supervision, and so that you're confident taking this back to your practice and implementing it so that you can use auricular medicine with your patients in your practice. The advanced course is designed for healthcare practitioners who are currently using auricular medicine in their practice and want to learn about some of these new remedies and new concepts that I've been working with in auricular medicine. So here are the dates. The intro course, just so you understand, is a 40-hour course held over 3 weekends. So these dates here are not different options of when you can come. You need to come to all 3 weekends. So these are March 2nd and 3rd is a Friday, Saturday, and they're all held on Fridays, Saturdays. And a couple things to mention here are on the Friday evenings, after I have a chance to grab a bite for dinner, I'll be offering some casual hours where we can sit down and we can practice and you can ask questions in a sort of a casual setting, so that to help you become more and more comfortable with this technique. And the reason that I'm spacing them apart, approximately a month apart each, is that I want to give you some knowledge, some skills, some things to try. I want you to take them home work with your family, work with your friends, work with patients that you know well. Practice these techniques. And I want you to come back to the second session with your questions, what you're having difficulty with. And again, between the second session and the third session, I want you to go practice it and come back. I want you to, when we finish the third session, to be comfortable using auricular medicine. And of course, after the third session, if you have, as I mentioned earlier, if you have any questions, if you need some guidance, I will be available. The advanced course is coming up actually in less than a month. It's again a Friday, Saturday, February 3rd and 4th. All these courses are being held in London. And here's the tuition. The intro course is $1,500 plus HST, and the advanced course is $495. This topic really excites me. I hope it excites you. If it does, please register. And one more thing, there's early bird tuition. The early bird tuition deadline is this Friday, January 13th, for both the intro course and the advanced course. So if you are interested, if you know you want to do it, I highly suggest signing up right away, because the early bird rates that we see here, $1,200 for the intro course, $395 for the advanced course, are only good until this Friday. After that, we'll be looking at the higher rates. I'd like to thank you for taking the time to watch and listen this webinar. I'd like to thank Dr. Cass and Physica Energetics for sponsoring it. If you are interested, please register. I look forward to seeing you at the courses. Contact Mary. The number is 1-855-668-0958. You can contact her by email at info or info@physicaenergetics.com. If you're interested in more information about Physica Energetics in general, Physica Energetics, www.physicaenergetics.com. And one last thing, just in case you didn't get it earlier, my website is www.caseybateman.ca. I thank you very much again for joining me, and I look forward to seeing you at the courses. Take care.